Welcome back, everybody. I'm Dr. Matt Harper with Avery Chiropractic, and today I'm going to be talking about one of the most important joints of your body. That's right, you guessed it, the knee. I can't think of any sport the knee's not involved with. Anywhere from football, go UT, to badminton. Anywhere along the line, you're going to involve that knee. So let's get to it. First of all, as we all know, I like everybody to know the anatomy of what we're working with. Let's talk about the ligaments of the knee. We're going to talk about your anterior cruciate ligament. This is the most important ligament of your knee joint. Responsible for joint integrity and strength of that knee. Damage to this one can be sports career ending. Basically what you're looking at here is the joint. This is your patella tendon, which one's right here. That's your big one where your quadriceps come up here and then attach down here on your tibia. Your ACL lies underneath it, which is right in here. That's one of the biggest ligaments of your knee. And then let's move on to your medial collateral ligament, which is bigger than your lateral collateral ligament right here. Think about it. And this is your posterior collateral ligament here. If you take a hit, say for example in football, right here on the inside, on the outside, which most hits come from, this has to be a bigger, more intact ligament to take that strain. But if a football player takes a lick from the inside out, he's going to affect this lateral collateral ligament, and you can see how it's so much smaller than the medial collateral ligament, so it's more at risk for damage. All right. Now, who I'm going to use today, I'm going to use Jennifer as my model. Okay, as you can see here, she's placed with her knee slightly flexed. She's got her hand up here on the wall. Now, what I'm going to ask her to do is remove her hand from the wall. As you can see, she starts to wobble a little bit at that knee. Now, I'm going to ask her to close her eyes. As you can see, she starts to wobble even more. Now, if she gets good at this exercise, that's going to increase what we call proprioception, or position sense of the knee, which is going to give you that quickness on the field when you need it. Now, what we're going to do is we're going to move on over here to strengthening of the knee. Now, what she's doing here is she has placed a foam roller with her knee on top of it and extending her knee about 30 degrees. You can use a pillow or hang your leg off the table just as long as you get this last 30 degrees of extension. This is going to strengthen the knee and make sure everything tracks right, is in the right position. You can add resistance by placing a hand here, or if you have an ankle weight, you can do that as well. These two things in culmination, increasing proprioception and knee strength, will ensure you have a long sports career no matter what sport that you play. I'm Dr. Matt Harper, your Avery Chiropractor and your News 8 Sports Doc, reminding you, Austin, keep it in line.